Hello, everybody. My name is Richard Wylie, and I am the Chief Executive Officer at Glaucoma Australia. Welcome to our session this evening. I'd also like to welcome our very special guest, Dr. David Wechsler, who's the leading ophthalmologist who's going to guide us through our talk tonight on driving with glaucoma. Very special week for us this week. It's actually World Glaucoma Week. So we have a series of activities this week to commemorate this really important week. But we greatly appreciate David's time tonight and his expertise on this really important subject for many of the people in our community. Obviously, getting to that point where driving becomes an issue with glaucoma is massively important to people. Driving is all about freedom. In some cases, it can be about the job that you do. So it's really, really important that we try and give as much clear guidance as we possibly can around the issues at play when you get to this point in your glaucoma journey. So we've got some questions which we've actually accumulated from a number of the questions that we get answered very, very regularly. So we thought we'd use a question and answer format tonight. So I'll lead off with the first question, David. So is there a way to obtain a conditional driving license?
Okay. Well, look, first, thanks very much for having me on tonight, Richard. It's a great pleasure to be here and to be able to speak on this topic. And it's a great pleasure to work with Glaucoma Australia again on this. I've been involved with this for a few years now. Around this time last year, I gave a talk on glaucoma and driving, and that's still available on YouTube. So some of the material will be there, but I'd like to sort of do my best to answer these questions and try and shed some light on a very difficult topic for a lot of people. So getting into the first question, is there a way to obtain a conditional driving license? Firstly, there's a slight terminology thing that we have to be clear about. And also, just at the outset, I'll say that I'm speaking from Sydney and New South Wales, and that there is some variation from state to state in terms of how the medical assessments for driving is assessed and how it's policed, if you like. But the actual rules are the same for all of Australia. Okay, it's a national guidelines. Now, getting to this terminology, when they talk about a conditional driving license, sometimes there's confusion between a conditional driving license and a restricted driving license. So anyone can have a condition on their license, and this has been my experience working in New South Wales, is, for example, if it's a condition that you need glasses for driving, then that's a conditional driving license. Specifically with glaucoma, if you have glaucoma and it's notified, then you will have a conditional license by the nature of the fact that there's a condition that it must be reviewed. So just having glaucoma that's not even causing a lot of problems in terms of the visual field could still result in having a conditional license. But what the person asking the question might be talking about is a restricted license. A restricted license is when you then restrict the driving, for example, no night driving or driving within a restricted radius of home. And this can be done for various reasons, not just vision, but for any medical reason. So there's guidelines for the whole medical assessment of a person for their fitness to drive. So getting to the next part of that question, which is actually also a little bit tricky, there's no hard and fast rules about the restricted license or when the restrictions apply. There is rules about an unconditional license. So in other words, if you've got perfect vision, if you've got no issues that affect your driving, then you can get an unconditional license. But once you start getting a conditional license, that's something that needs to be kept under review. And then if you fall short of the standards, you may then be put in or asked to go on a restricted license. The guidelines are a little bit vague on that, okay? And then it's a case of working with your health professional, be it the doctor, usually the ophthalmologist. Optometrists can do this as well, although if things get a little bit dicey, they often then involve an ophthalmologist as well. And it's then a case of letting the driver's licensing authority, so in New South Wales, it's the Road and Maritime Services, letting them know what the vision is and asking, or in acknowledging that the vision is less than that's required, suggesting some appropriate restrictions, such as only driving in familiar areas, not driving at night. For a lot of people that may be elderly, and I know not everyone with glaucoma is elderly, but often there are elderly people, it might just allow them to get to the shops and just do a limited range of activities. But there is a little bit of a grey area there, and it's a case of putting in something that the health professional thinks is reasonable, and it's then up to the driver's licensing authority whether they'll accept that or not.
Okay, great. Well, I mean, that really clears up a couple of questions that I had. So thank you very much. So, and just picking up on that, is there a difference with driving license restriction, let's say in a rural country town versus busy city roads? So imagine if I owned a property somewhere and I only needed to drive 5 or 10 minutes down the road from my farm.
Yep. So this is when we're doing the restrictions or making recommendations about the restrictions. It usually involves a two-way conversation with the doctor and the patient about what they need to drive for and what it might be, and to then come up with something that seems reasonable under those circumstances. The other thing is, I mean, on the one hand, if someone's got a significant impairment, you can have an accident around the corner just as easily as you can on a busy freeway. But if you're in an unfamiliar area, it might be harder to pick up on signs that you're not familiar with and this sort of thing. Whereas if you're in a familiar area, then at least there's not as many unexpected things that are happening. But it's usually a discussion of what the patient needs the license for, and then to recommend it. And we usually restrict the radius from home. I mean, in rural areas, it can be difficult. If conversely, if you're on a property that's 100 k's from the next town, it becomes very difficult. It becomes very difficult, and so it is based on a discussion. There's no hard and fast rules on the restrictions. There are hard and fast rules on what is acceptable for normal and or what's less than the required. But then after that, there's possibly a little bit of wiggle room. In terms of the visual field, you need 110 degrees of horizontal extent is regarded by the guidelines as normal. 90 degrees is less than that, but still deemed as acceptable. So if you're less than 90, that's pretty bad. If you're more than 110, that's good. And this is just oversimplifying something here, but you know, if you're over 110, that's great. If you're under 90, that's pretty bad. And if you're in between there, well, you know, it's not too bad, and you can generally make a case based on the circumstances, assuming the visual acuity, which is the visual chart's okay.
Yeah. Okay, great. Thank you for that. That's fantastic. And why have the sort of licensing authorities chosen a certain age after which you have to get yearly renewals for driving?
Sure. So getting back to what I said at the start, I think that does vary from state to state, because that does vary from state to state. So again, speaking about New South Wales, when someone hits 75, they will get a form every year that we then have to do. I think a lot of other states are very similar, but there may be some difference. There is nothing really in the rules that stipulates that. However, the risk of having an impairment goes up with age. So it is kind of concentrating the resources where there's more likely to be impairments. And this is not just vision or glaucoma for that matter. This is other issues as well. Dementia is a big issue. There's a lot of onus on GPs to clear people for driving, and patients who might have, what we call cognitive impairment, a big issue with the driving and sort of thing, and other physical things as well. Now, so as someone practicing in New South Wales, we often get this sort of dilemma, whereas you might have someone with glaucoma whose field's pretty dicey, but if they're under 75, that might not get flushed out by the system as much as it would when they're over 75. But I should point out the rules are the same. So they should, if someone's less than 75 and they've got a visual field defect, they should actually, when they renew their license, notify the RMS. But the onus is on them, if you like. So, for example, I got a form in the mail last week to renew my license. There's a question: do you have a vision or eye disorder that may affect your driving? So if I tick yes to that, that'll generate the same sort of assessment that people over 75 get. And the rules are the same. So it's not that the rules are different, but it's just how it's policed. And there is some variation from state to state. But I look, anecdotally, there are people under the age of 75 who have glaucoma, and it is a problem. And I suspect they say no to that question, which is actually not the right thing to do.
Yeah. Okay. First question from a watcher today, from Margot. How long can a person with glaucoma safely drive?
Sure. So the simple answer is it depends.
Yes.
It depends how bad the glaucoma is and whether it was picked up early or late and how fast it's deteriorating. Many people with glaucoma never lose their license. And it might be milder, it might be well controlled, it may not have impacted it. So the journey that you mentioned will be different for different people, and it just varies. And one of the challenges in managing people whose glaucoma is on the more severe end of the spectrum is that they're more likely to run into problems. On the other hand, though, it's good that we're talking about this for a range of people, because there might be people whose glaucoma is not affecting them in any way at all and their vision is 100% fine, but it's important to take it seriously and get on top of it, because it might affect their driving later. And once the field loss gets bad, there's sometimes not much that we can do. So even where it's not affecting them yet, it's worth taking it seriously and just bearing in mind that if it's not managed optimally, they could end up having issues with their driving later on.
Okay. Oh, well, that's actually a great segue into our next question. So this is from John. He says he's 81. He's had glaucoma for 40 years. He says his license was cancelled when he reached 75. He had an unblemished driving record, and for the last 20 years, his glaucoma had not changed according to his ophthalmologist, who he visits every 6 months. And his question is there any practical test available to establish one's capability to safely drive a car to satisfy Ausroads, etc., so he can regain his license?
Okay, so the simple answer to that, the answer is yes and no. The simple answer is no, this won't help him practically, in that the latest edition of the guidelines specifically prohibits an on-road assessment. There was scope in the past for people to do an on-road assessment in a supervised environment with special testing, and the current guidelines have specifically excluded those. I mean, there's relative pros and cons to each. I mean, some people say that it doesn't represent real life, or some people say that it's a danger to do it. I know there are orthoptists who do this sort of work who have done this testing and feel that it's a safe and valid thing to do, but it's specifically prohibited currently, which is unfortunate. Overseas, different jurisdictions deal with this in different ways. The United States is interesting in that they don't have a national framework, it varies from state to state. So some states will assess it where you can do practical driving assessments, and others won't. So unfortunately, currently, that testing is not going to be accepted according to the current Ausroads guidelines.
Okay, thank you for that. Next question is from Judith. She's recently lost her license because there are 4 blank spots in the middle line of the field test. She's wondering how she can still read the second bottom line on the eye test when she goes to the optician, and can still thread a needle, but feels like she but doesn't have the ability to still drive a car.
Yeah, no, that's a good question. This is something that comes up. So firstly, I just want to refer back to the answer I gave before when I was talking about, the 90 degrees, the 100 degrees.
Yes.
You've got the horizontal extent of the field. So a lot of us, when we first start thinking about glaucoma, we think about, losing the peripheral vision that's closing in, and you lose it all. It doesn't always go that way, though. That's not usually the way it does. What it does is it picks off parts of the peripheral vision, and then those blind spots join up. So there's 2 things that they ask us about the visual field. They ask the horizontal extent, and then there's also a rule about not having what we call a central scotoma, which is a blind spot in the middle, because the middle part of the vision is more important. So the current guidelines have defined fairly specifically that you can't have 4 spots together. If they're spread out more and it's not a concentrated defect, then that's okay. I personally feel it's a relatively arbitrary rule, but they're quite strict on enforcing it. They're quite strict on enforcing it. Just there's a couple of other things that I'll say about it. Someone who's only got one eye can still drive, and that one eye will have a blind spot. Someone who's got 2 normal eyes won't have a blind spot because they cancel each other out. I believe the rationale for this spot is that if you've got an overlapping thing, it's like someone with one eye driving with a big blind spot, something like that, and that you can miss something in that blind spot that's close to the vision. There is some proviso in the guidelines for what we call a roving estimate, or doing the field test where you're allowed to move your eyes, and that sometimes if you move your eyes or make some compensatory movements, that blind spot might not be as big. So you can repeat the same test and it's smaller, but it's at the discretion of the licensing authority whether they'll accept that and say that it's still an acceptable field. But there are people who have a good horizontal extent, but just this blind spot in the middle, and it's deemed to be unacceptable based on the current guidelines. Not all places have that. Australia does. Okay. Just going back a step further on that, I mean, the guidelines have chosen, and it's fairly black and white, what's acceptable and what's not. What we do know is that someone who's got perfect vision is going to have less chance of a collision, all else being equal. Someone who's got terrible glaucoma, can't see a thing, is going to have a terrible chance of driving safely, right? Reality is most people are somewhere in the middle, and they've drawn the line somewhere. Okay, and they've drawn the line somewhere. And look, there's all this research and literature that's tried to sort of work out what's safe and not, and this sort of thing. And it's no study that shows up conclusively 100% this is where the line should be. And different jurisdictions have dealt with it differently. But so that's why it seems like they've sort of put this fairly harsh cutoff on something which is what we call a continuous spectrum. I've been thinking about this a bit because, for example, I mean, we're all fairly confident about the 0.05 driving limit sort of thing. But I mean, if you just bear with me for a minute, like, I mean, I've been thinking about myself. They've gone 0.05. I mean, there's evidence that your risk of crash goes up when you drive more alcohol, drive with a higher blood alcohol level. I mean, if you have an accident, you're 0.04. That's within the rules, but that 0.04 still would have put you at slightly increased risk of an accident than if you had no alcohol. And similarly, if you could have been 0.06, that's suddenly a criminal matter. Whereas there's not. Do you see what I'm saying? But they've drawn it there. But having said that, I believe that the research in that area, although I'm not totally familiar with it, there's more of a evidence base where they've said, right, this is the line that we're going to do. And now they've attempted to do the same. It seems to me, this is just my personal opinion, they've attempted to do the same thing, with visual fields, and to try and work it out. And so, I mean, you might have someone who's just one side of what's acceptable, and they might not be any better or any worse than someone who's just on the other side, but they've just had to draw the line somewhere. Just the final point on that about the threading a needle, that's to do with the visual acuity, and it's not to do with the visual field. So it's different. And so that's the other thing that people don't understand sometimes when we're doing the forms, or if they go to their GP to get the GP to do the forms. The GPs usually are pretty good at assessing, the visual acuity. They'll have a chart in their consulting room. But the visual field, you can have normal 6/6, what we call 6/6 vision, what the Americans call 20/20 vision. You can have normal vision, but still have terrible field loss and still be at risk of collisions on the basis of that. But it is hard. That particular item of the guidelines, I find the hardest one to deal with patients. And me and a few patients have struggled with this very point. What we've tried to do is make the argument that when they can move their eyes, that they can somehow compensate for it and get a little bit less than that. But it's up to the discretion of the driver's licensing authority if they'll accept that or not.
And I guess it's a logical question to follow on from that. Are ophthalmologists, optometrists and GPs legally obliged to report someone who's become not fit for driving based on vision or visual fields?
Okay, so this is something that varies from state to state. In most states, they're not legally obliged to. It becomes a bit tricky if someone's a bus driver or doing something like that where it's the public safety factor goes up even more. There is there's a few competing sort of legalities. I mean, there's patient confidentiality, but then there's also a sort of public safety obligation thing. The way it works in most states, so I think Northern Territory have mandatory obligation, and one other state, I can't quite remember which one it is, they actually do have, they are legally obliged to basically tell the driver's licensing authority in that state. In most other states, we're not, but the obligation is to then discuss with the patient that they shouldn't be driving. And sometimes we can word it quite strongly. If the vision is really very poor, then we can word it quite strongly that they should not be driving. If someone's borderline, and going back to that last question, I mean, a lot of the time we're on the side of the patient. We feel they're borderline, that it's not that bad, but they've been driving well and that sort of thing. We would try and go into bat for them and present the best case we can. But at the end of the day, it's up to the driver's licensing authority.
Fantastic. That's a great answer. Thank you very much. Question from David. He only has loss of vision in one eye. How is that factored in a vision assessment?
If the other eye is completely normal and he has a normal car license, it shouldn't be an issue. Okay. Where the issue is, they've got two standards. You have the private standards and the commercial standards. So there's different types of licenses depending on what you're driving. But for the point of view of vision, there's only two real levels. There's the normal car level, which also includes like a light sort of bus or a light truck or something. But once you get to a medium truck or a bus or anything, or a taxi for that matter, or anything where you're doing it commercially, it becomes a commercial standard. So if we're just talking about the normal car standards, then one eye, if that eye is normal, you should be fine.
Okay. Oh, that's good to know. Fantastic. Let me see who we've got next. How do you determine someone is borderline in keeping their driver's license, and how long do you give them till their next visual field test?
Well, how do you determine someone's borderline? We will usually be doing it every year. Because there will be, once someone's got a conditional license, if they're over 75, they have it done every year anyway. But even if they've got glaucoma and they're under 75 and we've said, look, they've got glaucoma and that the license it's a condition on their license that it must be under review, it would be 1 to 2 years, at least a year, or possibly 2 years if it's very stable. But you can there are conditions where the specialist can specify when it should be reviewed, and this goes for other conditions, not just vision. So, for example, some people with diabetes who are under the age of 75 have to have medical assessments done every 2 years because they've got diabetes, because that becomes a conditional license as well. How long do you give them to next visual field test? So we also have to make an assessment whether we think the visual field is stable or not. So if someone's very stable, then we don't need to do the fields as frequently. But if we think that their glaucoma is unstable and they're likely to progress, then we need to do it. Sometimes these intervals are set by the driver's licensing authority, okay? But there's also an element of clinical judgment as well. If someone's had a field test recently, say we've done a field test last week and then they come with the form the next week, then I'll do the form based on the assessment based on their recent field test performance. But if they've had it done 6 months ago and they've got significant glaucoma and they then need some sort of report, then I think they're going to need to have another field done, unless it's really mild and really stable.
All right, thank you. And are you aware of any technical advances that are coming up which might help detect objects for those that have lost their field of vision? I mean, almost similar to like a GPS in the car, which can detect objects. And I mean, Tesla has their sort of automatic driving, doesn't it?
Absolutely.
Shapes coming up.
Yeah, I mean, my car, I was backing out of the driveway and my car stopped itself because it saw someone coming along behind. I mean, there's a lot of technology in a lot of cars and it's good. The other thing I'll say is that when this so-called self-driving car actually comes, this may make all this drama a thing of the past. But there is technical advancements in cars that's helping driver safety in general. But whether the driver's licensing authority would actually look at that and allow you to keep your license on the basis that you say have a car that's got all these extra sensors, I don't think that's something that they've been shown any appetite for doing. It's something that's been looked at in the past. I don't think there's any appetite for sort of taking that on. I'm going to give you an example. I've got a patient who's he's an amputee. So on his license, it says must drive an automatic car. So it makes sense you can't drive a manual, because he can only, So I mean, there is precedent for saying, I mean, I think the case has been tried to be put to them before. Can we say that maybe if someone's got a certain level of vision, can you give them a license, saying if you have a car that's fitted with X, Y, and Z, then they can. I don't think that's going to happen in the next little bit of time. I don't see that happening, unfortunately, because I think there's too many variabilities, and there seems to be a certain amount of aversion to risk in these things. And unless there's a clear study that shows people with glaucoma at this level, if it's got a car fitted with this X, Y, and Z, then they're at no increased risk compared to an able-bodied person. Then, and I just don't know if those studies are going to come. If they do, there'd be a stronger case for it. But until then, it tends to be a fairly risk-averse attitude to some of these guidelines. That's my personal feeling, though. That's my personal. Yep.
Fantastic. Thank you. Oh, well, hopefully there's a lot of exciting technology coming through. You never know.
There
As you say,
there definitely is. And
we
look,
might have 100% autonomous driving cars in the next 10 years. Changes the whole thing.
Talking about it for a while, but yeah.
But I think thinking about it conditionally, I think that's a very practical place to start, isn't it? To say, all right, maybe under what circumstances could I drive, safely, I guess, whether that be avoiding low lights, staying off crowded roads, all those things you were mentioning before. I mean, at least that gives, I guess, an initial kind of step down that people might be able to, park themselves at for a little while.
Yeah, and actually, if I could share one story of a patient recently, is that he actually then decided he was okay with regards to the guidelines, but it was fairly borderline. And I know he had a fairly high-powered car. He actually decided to change it and get a powerful car.
That's a good point.
One that his wife could drive. She didn't like driving his high-powered car. And I think it's good to have the conversation. I think where it's good, I mean, we have a lot of difficult conversations with people all the time, and it's very difficult. But if these things have come up earlier, then it's better to sort of plant the idea that this could be an issue in the future, and people maybe start preparing for it and that sort of thing. Then that's helpful as well. Yeah.
Oh, that makes sense. What about alternatives that you discuss with your patients once they do lose their driver's license, particularly if they're living in areas where there's not a huge availability of public transport?
Look, it can be a very big issue. It can be a very big issue, and we talk about what their needs are, what their situation is, who they've got living with them or nearby, who they can help with, what public transport options there are. I mean, there are various subsidies and things, and there is to some extent some sort of social safety net that, given that we live in a country where there is a reasonable social safety net. Having said that, for example, if someone is legally blind, obviously they can't drive, but they're entitled to certain entitlements and things and subsidies and this sort of thing. And sometimes a lot of the paperwork that comes for these things, if someone is legally blind on the basis of their visual fields or their visual acuity or both, then it somehow makes them easier to qualify for this. You do sometimes get these people who are in the middle, though, and we've talked about this with regards to financial assistance, and it also pertains to driving. You might have someone who, 1 minute they were driving, that's fine. The next minute they can't drive, but they're not yet legally blind. They're in the middle somewhere. And obviously with our treatment, we're desperately trying to prevent them being legally blind. And sometimes there's not a lot available to them, unfortunately, those people in the middle. So it will vary on a case-by-case basis. Just getting back to the restrictions, I like to sort of say to the patients that if we're recommending restrictions or reducing the radius, that we're sort of acknowledging that there is an issue here, and we're sort of coming to them with a potential compromise, so that it sort of covers ourselves as well, rather than just saying, oh, everything's fine and then there's a problem. It's sort of acknowledging the fact that there's something there, an issue that may affect driving.
I can do a bit of a pre-sell for one of our Q&As on Thursday night, but if anyone wants to tune in at 6 p.m. This coming Thursday night, we're actually talking about what are some of the financial support mechanisms for people who are living with glaucoma. And we're actually talking to a patient who decided that it was the best thing for him and also for the safety of the community that he stops driving. And so he's obviously had to work around that with various services and things. So we might be able to elaborate on that subject on Thursday night.
That'll be a very interesting subject to discuss with him. Yeah, absolutely.
Exactly. Great. All right. Well, listen, we're almost through 30 minutes. So I've got a final question from Josephine. At what point should I declare that I have glaucoma to the driving authority? She's currently age 50. She's had glaucoma for years. She believes it's stable and only minimal damage to one eye.
Yeah. Look, there's this fairly simple answer to this. I mean, the answer is you should declare it, okay? They're not going to do anything differently. The rules are the same. I think the reality is a lot of people in this position don't declare it, and that's not being honest with the driver's licensing authority, if it's in New Zealand, the RMS. I mean, if you declare it, there'll be an assessment which is the same assessment that's done on our patients that are over the age of 75, but the rules are the same. The rules are the same. And if it is stable and only minimally damaging one eye, then there'll be no problem with you passing. There'll be an extra bit of paperwork to do, maybe once a year or every 2 years. And if you organise your appointments with your specialist at the same time, you can sort of kill two birds with one stone. But the simple answer to that is yes. Unfortunately, I think some people often say no and don't declare it, and it just goes on unmissed, and it's not doing the right thing by the community. Can I just put in a plug as a practicing glaucoma specialist in the area, and for all my ophthalmic colleagues, if you could let the doctors know when you do get one of these assessments ahead of time, like if you come for your appointment, if you tell them you need to have it done, it makes things a lot easier, because the field test that we do, it's the same machine, but it might be a different field test. And so, you know, we're doing all this other stuff, and then you go, oh, I got to get this for the thing as well. If you can let us know as soon as possible, as soon as you get into the premises, it makes things a lot easier for us, because it's difficult for us as well. You know, we've got a lot of things we need to do looking after patients, and then to do this for people as well. It's much better if we know ahead of time that that's what's going to happen. Okay, and if you can coincide your appointments prior to then, that works well too. Yeah,
that's great. That's fantastic advice. Thank you very much. I'm going to slip one more bonus question in, because it was kind of related to Josephine's, but Rebecca asked, very similar to Josephine, but she has a teenager who has congenital glaucoma, who's actually coming up to 16 years old. I presume she's wondering, is this the sort of thing we should disclose to the RTA when she's going through her L's and her P's and things like that?
Look, I think it is. I think it is. I think the situation may be different to people that have had these long-standing defects. If it is stable, they may have adapted in certain ways. But the problem is congenital glaucoma, it is a progressive condition. So I think it should be disclosed and have to be looked at, and it could be an issue for the driving, depending on how much field loss is there, really.
Yes. Well, listen, thank you so much. I know that this is a very emotionally charged subject for a lot of people, and I can totally understand why. If you rely on your driver's license for a job, you operate heavy machinery, that's obviously, the stakes are even higher. But, for people, the fear around losing mobility, the ability to drive themselves to places, availability of public transport if they can't drive, whether they've got, loved ones or carers that are able to, move them around. It's very, very important. I guess I would just finish off by saying, while of course we all think about what does this mean for us, we do know that, deaths due to driving accidents are a real issue, not just in Australia, but also around the world. And, please don't put yourself in a situation where you kind of think, maybe I shouldn't be doing this. And at the end of the day, if something terrible, tragic was to happen, I'd hate for you all to live with that for the rest of your lives. So I think we do need to think about it both ways.
I think that's exactly right, Richard. I think that's exactly right. And,
all right. Well, thank you very much, David. For also just for all the work you've done for Glaucoma Australia over the years. You're always a font of knowledge on these things. Thank you for giving up your personal time. I hope this has been interesting for everyone. I've gotten a lot out of this. I've learned a lot myself tonight. As always, if you do have questions, we have a really fantastic set of resources, not just on the Glaucoma Australia website, www.glaucoma.org.au, but also these Q&A sessions that we have on our YouTube channel. There are just some fantastic sessions that we've done historically, including some with David. So make sure that you go and check out all of those, because you may well find answers to your questions in all of those resources. So thank you again, David. Thank you, everyone, for tuning in.
Thanks, Richard. Thanks for having me.
Very happy World Glaucoma Week. All the best.
Happy World Glaucoma Week to you.
Sorry, and I forgot. Sorry, I absolutely needed to remember to do this. I just really wanted to say a massive thank you to our sponsors of these live Q&A events, Glaucos. They've very generously sponsored an entire year's worth of these sessions. It's such a valuable resource for our patients and for members in our community. So thank you so much, Glaucos, for your generosity in helping to make these things achievable. All right, thank you, everyone. Wishing you all the best. See you soon.
Thanks very much, Richard. Cheers. Good night, everyone.